Buenas and half a day. Many of God's blessings to all of you here this afternoon. The hearing by the Committee on Public Accountability, Human Resources, and the Guam Buildup is called to order. It is now 5:05 in the afternoon. For the record, and in accordance with 5 GCA Chapter 8, subsection 8107, public hearing notices were sent out on Friday, May 31st, 2019, adhering to the 5-day notice, and a second public notice was sent on Wednesday, June 5th, 2019, adhering to the 48-hour rule. In addition, ladies and gentlemen, this hearing was noticed on the legislature's website. It was at www.guamlegislature.com. Written testimonies may be submitted by emailing speaker@guamlegislature.org, or you may hand deliver your testimony, written testimony, to our office at Guam Congress Building, number 163 Chalan Santo Papa, Hagatnya, Guam, 96910. On the agenda, ladies and gentlemen, we have bill number 94-35, as introduced by myself, and I want to share with you that it's an act to amend Section 4302C2 of Article 3, Chapter 4, Title 4, Guam Code Annotated, relative to ensuring that the two most economical and beneficial healthcare insurance proposal plan for Government of Guam employees, retirees, and foster children are forwarded by the Government of Guam Health Insurance Negotiating Team to Imaga Haga Guahan for consideration. Joining me here this afternoon or early evening, ladies and gentlemen, I'd like to thank Senator Therese Chalahi, who has the Oversight Chair on Health, Situas Maasi, for joining me here this evening. The conduct of the public hearing shall be as follows, ladies and gentlemen. Those testifying will be recognized in the order of the sign-up sheets. Written testimony be read in the interest of time. I ask that testimony be summarized to about 5 minutes. Written testimony shall be submitted to the committee. Please provide our legislative staff with your written testimony for photocopying if you haven't done so already. Testimony shall be confined to the substance of the bill. Persons will be allowed to present oral testimony only once. Once you are done, you may be asked to remain in the room for questions or for additional testimony as may be desired by members of the panel. Proper form and decorum shall be practiced by all present in the public hearing room. For the proceedings, individuals who do not comply may be escorted from the public hearing room. When you speak, I kindly ask that you please make sure that the microphone is on. The red light would show that it's on, and that you speak into the microphone. I also would ask that you please kindly state your name, what agency or where you're from, and if you support or don't support the bill in your testimony. With that being said, we will now hear bill number 94-35 COR. And on the sign-up sheet, for those who are in the room who have not signed in, you're more than welcome to either sign in and note that you're going to present oral testimony or oppose it. And if you don't want to speak, you can at least just sign in and just note if you support or oppose the bill. I have Mr. Ed Byrne from the Department of Administration. You're more than welcome to come to the panel, sir. I also have Mr. Frank Campillo from Calvo's Insurance. If you can also come up. I see you, Mr. Leon Guerrero, if you're okay. And I also see Mr. Kanata. You're more than welcome to come up if you're just here to support and listen. Thank you, gentlemen, for being here. Mr. Campillo, if I may, I will go ahead and yield to the administration and have Mr. Burr share his testimony on the bill.
Good afternoon, Speaker and Senator. My name is Edward Byrne, Director of the Department of Administration. Thank you for the opportunity to offer testimony on Bill 9435. With respect to the preamble of the bill, a fiscal note from BBMR dated April 26, 2019 has already recommended a change of wording so that it conforms to Section 1. The procurement of the annual health insurance policy by the Government of Guam is the single largest purchase which the government makes. For that reason, the process is performed by a committee of knowledgeable government employees representing all its agencies, and also includes a member representing the taxpayers of Guam. And its task is to format the RFP, evaluate the proposals received, and to recommend the best package to the governor. Given the inherent complexity of health insurance, the fact that the policy covers both active employees, their dependents, retirees and their dependents, and the policy itself within it has coverage options, this task is daunting. I would like to thank all the members of the negotiating team who devote a considerable amount of time and effort to this process. Current legislation requires the team to forward the best available proposals which reflect the most economical and beneficial proposal plan to the governor. This bill adds a new definition in place of best available. It would mandate that the two most beneficial proposals be forwarded to the governor for consideration. It is true that under current law, the process might result in only one policy, albeit with options within that policy. The evaluation of these proposals is complex and multi-layered. The negotiating committee has developed criteria. The current RFP has been designed to address the definitions encapsulated in current law. If enacted, the proposal which we have received but are not yet opened because of the protest and the subsequent appeal of that protest by Take Care might not address the redefined criteria in this bill. The bill is effective upon enactment and might impact the ongoing procurement, assuming it is proceeding as planned. It is recommended that whichever wording is finally codified, the bill be effective for the subsequent financial year. In general, a purchase of this complexity is best achieved by the operation of market forces. DOA has no objection to the definitions of most beneficial in paragraph 9A. Indeed, these attributes have already been included in the RFP criteria, and the RFP is available for viewing on the DOA website on the HR division. In summary, other than the mandate to forward two proposals to the governor, DOA feels that the tests indicated for measuring how beneficial the proposals are, and the test of how economic the proposals are included in the RFP, which has indeed requested both a narrow and a broad network quote. So both of these can be forwarded to the governor, and she can determine which are more beneficial and economic upon reviewing the recommendation from the negotiating team. Thank you for the opportunity to offer testimony on Bill 9435.
Thank you, Mr. Byrne, and I know your testimony is handwritten, but if we could get a copy of that, we truly would appreciate it. If we can accept it the way it is, or you can send it to us before so that we can work with it.
If I may, I'll have it typed up and send it over to you.
Thank you. Thank you. And I was so eager to have you as presenters say yours. I forgot to note my opening statement, and if I can, Mr. Campillo, go ahead and state that for the record so it can be appended into the committee report. I'll just read my opening statement, if I may. Thank you. And I want to share with those listening tonight and those in the audience this evening that when Bill 94-35 was introduced, it was to ensure that our government of Guam employees continue to receive the highest quality health coverage that our island can provide. A couple of months ago, I sponsored a measure that was passed into law requiring all health insurance companies contracting with the government to include both hospitals in their network. This body agreed that during a life or death emergency, the hospital fee should be the furthest from their worries. They should be more concerned about recovering and they should be more concerned about recovering and treatment than their bill. Now, the measure we are discussing today, which is Bill 94-35, will allow two proposals to be forwarded to the governor of Guam, to the governor and the legislature, because again, our people should receive the highest quality health care possible and not the lowest cost option. I want to share with the listening audience and with those here in attendance tonight that in review of the OPA report number 1805 on the government of Guam's health insurance contract, it was noted that 84% or 9,917 subscribers per year did not choose the lowest cost option. They chose an option that would provide them more care. Additionally, it was mentioned that the most economical plan was not always the most beneficial. I want to share with you that this report is here, and it's a part of the we will attach it as a part of the committee report so that my colleagues and those who want to read it, they're more than welcome to read all the details of this performance audit, which was reported on June of 2018. I want to share with all of you that this bill will put our employees first, allowing for the most beneficial plan. So at this time, thank you for letting me read that into the record, and I will call Mr. Campillo to share his testimony.
Thank you, Speaker Muña and Senator Lahi, for having us here today. My name is Frank Campillo. I am the Health Plan Administrator for Cabo Select Care. We're here to fully support Bill 9435. We have, in various testimonies in the past, repeatedly said that we are a company that supports choice. We welcome other individuals or other companies providing benefits and services to the government of Guam, employees and retirees, and for that, we support this bill. I also would like to say that we thank the leadership that Ed Byrne brings to the committee, and he's right. We also like to recognize the work that the committee members do to ensure that the government of Guam employees and retirees get good health care. So all we here to say, Speaker Muña and Senator Lahi, is that we fully support this bill.
Si Zuas Masi, Mr. Campillo, and I just want to say thank you again to you and your insurance company for really working with the government and also doing the due diligence and making sure that as we go on this journey that we believe, or our committee believes, that we want to make sure that our employees and our retirees are afforded that opportunity. I'd also like to take this time to thank the Oversight Chair on Health, who's very, very keen into her oversight on health, and I'd like to give her the opportunity to ask any questions or comment anything as it relates to asking you questions or on the bill or commenting on the bill.
Thank you, Madam Speaker. Mr. Byrne, you mentioned something about the preamble, but we didn't catch that. What did you say? It was like your first sentence about a preamble.
I was just mentioning that in the fiscal note, it noted that there was a difference in the wording between the preamble and the section of wording 1. It quoted a different section of the code.
Okay. Yeah, I don't. I don't have a copy of the fiscal note. Can you tell us what the fiscal note reflects? We don't have that. At least the bottom line.
I have the fiscal note here. Let me read the relevant section that Mr. Carlson generated. The Bureau notes that Section 1 of the proposed legislation cites the amendment to be made to Section 4302C9 of Article 3, Chapter 4, Title 4, Guam Code Annotated, but the preamble of the legislation cites 4302C2 of Article 3, Chapter 4, Title 4, Guam Code Annotated. I think it's the C9, C2 reference.
The title, yeah. So the title says C2, the bill says C9. Okay. All right, what does the fiscal note reflect as the impact?
The proposed legislation deletes the language best available to now read to most beneficial and makes no change to the mandate for each proposal to reflect the most economical and beneficial healthcare insurance proposal plan. As such, the proposed legislation is administrative in nature and poses no fiscal impact upon any funds of the government of Guam.
If I may, Mr. Byrne, if you could also just provide us a copy at this time. We don't have one, and we'll be more than glad to make. Thank you.
Of course.
Thanks. All right. My next question is just a little technical. So this bill proposes to amend 4302C9, but it's my understanding that the last bill that was enacted amended 4302C2, and that was the bill that was enacted by override, despite the veto. And so I just noticed it here now, so I'm not sure what's the impact of having one code section saying one thing and another saying something very similar but different. I mean, it looks contradictory to me.
In our review, if I may, it was that original bill that was passed that had the error, not this. Yeah.
Oh, so you
So
think
that-
this original bill should have said C9?
The wrong section.
Mr. Leon Guerrero, that would be, if you could just come to the table, please, and just note that for the record so that our listening audience can hear.
Yes. Yes, Speaker. My name is Paul Younggrove, CFO for Cabos Insurance. Good evening, Speaker and Senator Talahi. In our review of the bill, actually the bill had amended a wrong section of the law. And when we looked at the Guam Code annotated, apparently the comparative law did not pick that up, and because of the discrepancy. But in my review and discussion with the legislature, that existing law still stands, even though it wasn't codified. And just to make it to be clear, there were two things there that it was stating. One was defining most economical and beneficial as the lowest cost. So it was defining that as the lowest cost. Secondly, it indicated that only one was to be submitted to the governors for review. And what the bill currently, our understanding now is to say we want to, is to amend that now to allow the negotiating committee to submit two and remove the lowest cost as the definition. The way I look at it is if you're going to keep the lowest cost, this is not an RFP. This is a bid. You're just going based on cost. Then it's not a professional type of service we're talking about. That's my opinion when I review the existing legislation.
All right. Well, my concern is that the bill doesn't show that whole paragraph that you're describing that you want to be removed. The
Right.
paragraph that was enacted to say the negotiating team shall forward only the single most economical and beneficial healthcare insurance proposal plan. That whole paragraph, I think you
You're
want
right,
to be
Senator.
deleted. It's not showing here that that's going to be
You're
deleted.
correct, Senator. And matter of fact, it's interesting because back in my government days, when we do amend things, we actually state and we indicate what's actually either amended or deleted.
Yeah, we're supposed
But
to.
I notice now, though, in the way legislation is written now, is kind of different now.
No, I think there's an error. It's obviously,
Yeah.
right, not
Yeah.
intended that, yeah, so it's clearly an error because we're supposed to be showing that. And the reason
Right,
we're
right.
supposed to show all of that is so that the public knows
What's actually
exactly
deleted and
what's
what's amended.
happening, that they know now that this will no longer have this single
Right.
most economic, okay. When this, so do you agree then that this bill before us that we're talking about today is intended to repeal what the legislature enacted last year through an override of the governor's veto? Mr. Campillo?
Yes, technically you're correct, Senator. Yeah.
Yes, all right. At the time of the veto of the bill and prior to the override, the speaker whose bill it was at that time issued a statement stating that on the date of the veto, that today Governor Cabo failed Guam's taxpayers, and sooner or later each of us will pay the price for his mistake. Every time someone tells you the government doesn't have enough money to fix our roads, fully fund our schools, or put some cops on the street, I want you to remember that over the past 4 years, the administration has given insurance companies a $50 million gift, choosing the health insurance contract that costs more even when benefits are exactly the same as its more affordable option. Choice is good, but I sponsored this bill because late last year, one of our insurers confirmed that they were days away from suspending coverage for our retirees because DOA couldn't pay. When choice is so expensive that even one person is threatened with no coverage at all, why do we continue to make promises we can't afford to keep? And so it would be a big shift with that in mind, that to go from what we just enacted last year to this now. Mr. Byrne, might it be more expensive, as the speaker had predicted back then, to go with this bill and allow, instead of the single most economical, the two most beneficial?
It's very difficult to predict what might happen when we don't really know, and we don't have any data for this year because of the circumstance to even start drawing a conclusion. I mean, in theory, yes, the wider the menu, if you like, of options available to an employee, you might conclude that become more expensive. However, I'm sure I can rely upon insurance carriers, including the one on my right, to try to offer the most beneficial and economic plan. Because, as I said in my testimony, it's a lot of money, and they have their way of actuarially computing what the cost.
But Mr.
would
Byrne,
probably
based
be.
on past, if I recall correctly, the speaker he was getting his information based on letters that were sent after all negotiations were completed, letters sent to the governor, which offered the governor proposals for a single plan that was, or proposals with more than one plan, and that for the last 4 or 5 letters that were sent to the governor after negotiating teams had completed their work, it was always the single plan or the single option that was, and he's quoting here, what did he say? $50 million apart from the ones with choice. I mean, that's his estimate in savings from going from a choice to a single plan. And so I saw the letters myself, and they seem to all be very consistent. Are you saying now that I know you're going to tell me we can't predict the future, but based on all the letters that we've seen in the last 4 or 5 years, isn't that correct that the difference shows quite significant when it comes to single versus more than one?
Well, as I think I just said, you know, the probability is that the wider the benefits or the deeper the benefits, the more it's going to cost. But I really am reluctant to draw a conclusion about something that might happen based upon what happened in the past, and I really do encourage.
I'm not going to ask you to predict then, Mr. Byrne. Just tell me what happened in the past.
I do encourage please, can I just
Sure.
say, because I think it's important, I do want to encourage, you know, the carriers to look very carefully at their costs, because, you know, there might come a point where, you know, you yourself, Senator, mentioned that from time to time, you know, because of the cash flows we have difficulty paying, that there really is very little purpose in proposing a very expensive plan if it can't be paid, right?
Thank you. Mr. Byrne, there's language here that says, oh, I'm sorry.
Did you want to say anything, Mr. Campillo, based on the inquiry?
Well, I wanted to provide
Sorry.
some clarification, Senator Terlahi. So, and again, the information that I'm going to give, clearly we didn't have any access to whether or not somebody else was lower or not in the previous RFPs. But what we have asked of even the government of Guam and their consultants is to validate something that to us is extremely important. Were those numbers of the lowest bidder then sustainable? Because if you have numbers that are too low and you cannot pay your claims, you actually can create a complete market disaster in the island. So you, for instance, if I compare the federal government in the way how they purchase their benefits, is that they have actuaries that tell you, look, your rates are too low, we need you to be around, we need you to readjust your rates. So they look at both sides. Your rates are too high, you need to readjust your rates. They're balanced. And in regards to the government of Guam, and because we don't have access to that information, we don't know if those rates that were quoted as low as they were quoted based on the information that the former speaker mentioned, if they were really sustainable, or if you would have a bunch of clinics and a bunch of providers today not being paid because the numbers were not sustainable.
Okay, I understand, and I remember that testimony from you in if that bill was being passed last year. I would just, I'm having a hard time because I'm trying to compare what the language says now in the law versus what the bill says, and there are words missing, so it's not exact, but so Mr. Byrne, there's the new language, well, it looks new, maybe you can confirm. The new paragraph A, it's all underlined in the bill, so it looks like it's all new. The last criteria, you said you have all this criteria in your current RFP, but the last one that says demonstrated consistent high level of member satisfaction through measurable surveys. Is that in your RFP?
Well, it is to an extent. We haven't gone out and surveyed members in 100% as to the satisfaction with the particular carriers. The carriers themselves have some data on that, and perhaps Mr. Campillo will like to speak to that. But certainly we know, because we get all the complaints, you know, the benefits department at DOA gets all the complaints. We know where the employees are dissatisfied with the product. Yes, but not using that exact word, and that was what my concern was, that we've got some of these elements to an extent in
We've
the
got a
RFP,
satisfaction
but not
element,
exactly.
but
We've got
not
a
necessarily
satisfaction, yes.
member satisfaction surveys, right?
Exactly.
But that's my concern too, because the way it's written here looks to me like they have to have demonstrated high level of member satisfaction. And I'm wondering that means current members or past members, I guess past members, prior members, and that means that no new company could ever bid on our health contract because new companies never had these members. Is that right? I mean, you understand what I'm saying?
You could interpret these words to mean that a new bidder could demonstrate that their current members or other members are indeed satisfied with their product.
All right. Well, I hope so.
Well, and if I can clarify that further, the federal government mandates you that you actually survey your members, and they have an independent firm that does that for you, and it's called the Consumer Assessment of Health Plans. So I would assume that if you have a new company, a new carrier, that they also have members, other type of members that they survey, and those members provide information as to whether or not they're satisfied. So I don't think they're specifically stating the government of Guam members. I guess they're saying the members that you have demonstrate or support that you're providing a high level of satisfaction to your members,
Well,
whether it's commercial or federal or otherwise.
So I hope that it can be interpreted like that if this bill passes, right? So that we can accept new companies. What about, so I agree with you that where it says they have to have met the required minimum benefits, that I surely hope that's in the RFP, right? And offers reasonable and sustainable rates. Now that word sustainable is added in. Do you have that in your RFP?
Again, these words are not exactly obviously what happens in the RFP. We would be concerned, but again, no carrier is going to interpret the future either. No, this is a one-year RFP.
Right.
We could have gone forward with a 2-year RFP, and that might have addressed the sustainable rates issue, but that's not what we chose to do because of changing conditions, and they change frequently.
All right. I'm just trying to get a real precise answer as to what might be different between the RFP that you've already issued and that you've got proposals sitting there unopened, waiting to be opened after the protest is taken care of, and whether I guess you alluded to it, that this might, in the end, require a new RFP be issued if we're going to implement it this year.
Exactly, because we can put something in the RFP, but until we actually review the responses, we don't know whether the carrier has been responsive.
All right, and if we did that, if you have to issue a new RFP, are you likely to complete the process by October 1?
Well, if the original proposal was to complete the process by last Friday.
Right.
That obviously didn't happen because the whole process was stopped. Every day that we lose, we are challenged to actually get to the end. If we started a new RFP today, it's possible, but until we open those, we're in a position where we can open those proposals again. It's hard to say.
Then I appreciate your recommendation that the effective date be next year. And I appreciate your efforts to try to conclude that whole negotiation process and the new contract process in advance of the budget being adopted. I think that would have been very helpful. What about the words broad and comprehensive? Do those sound different to you, or some? I'm just wondering, the word broad, it's not defined here, if you have used that already.
Yes, we did, because we asked for a broad and a narrow. That was a kind of shorthand we used for for the RFP. Comprehensive is kind of more difficult because that has an element of judgment in it rather than a definition.
I see. Thank you. I think now I'm going on my memory, it's not that reliable, but now I'm remembering that this vetoed bill that I'm looking at also doesn't include that other definition that you brought up. That was done in a different bill, right? Where we defined the word, one of the words, maybe economical or something, or beneficial.
You know, Senator, that's interesting because the Director of Administration did not bring that up because that's the section that was not codified.
I see.
Yeah.
Okay. I was going to ask you something, Mr. Campillo, I didn't write it down, but what would you describe would be the biggest, I mean, do you expect that this would result in a more expensive contract than what the RFP has currently called for?
Well, cost is not based on the actual RFP. Cost is based on utilization, and cost is based on healthcare increases. For instance, as you know, GMH just increased their fees by 5% on the facility side. On the physician side, they increased them even farther. Every single provider in Guam is pressured to increase their rates. So the cost of a health insurance is based on two factors: the actual increase on the service itself and the actual increase on the utilization of the service. As you know, Senator, our population has become a little bit sicker. For instance, I just concluded a briefing of a few number of employer groups, and it was shocking to me to have to reveal to these employer groups that the amount of increase in type 2 diabetics, for instance, in the island is going to the roof. And as you know, the cost of prescription drugs, including insulin, and those have gone through the roof. So the cost of health insurance will be reflecting the cost of what those services are being charged to us. I also wanted to share something with you in regards to maybe some modifications that I have recommended in the past in regards to how the government of Guam acquire health insurance benefits. The federal government, they qualify you only once. So this committee doesn't have to go through, again, your annual financial statements because they already pre-qualify you. For current carriers, what they do is they allow you to just modify your rates based on new benefits and new services that the federal government may require. If you have a new company that is going to come in, then you have a qualifying process as opposed to having to go through this every year, which becomes very expensive in my opinion, not only for you, the government of Guam, but also for the carriers that are having to do this renewal on an annual basis. As I said before, Senator Terlahi, the federal government only requires you to provide a letter that is no more than about 5 pages as your renewal, as opposed to these 18, 19 binders this big, and in a time where we're trying to save the trees and save our planet, I think it's time that we think into something that is more logical and more sustainable in the future. You qualify the company once, and then the insurance commissioner verifies that yes, the company is meeting what is called the risk-based capital. But other than that, if you already, we have sat in front of this gentleman, well, I guess we haven't because he's new to the Department of Administration, and the last couple of years the system has been challenged. But we have sat in front of the negotiating committee for the last 19 years. By now, they all do my accent very well, but they know who the company is, so you don't need to requalify the carrier year after year. What you need to do is If you have a new company, qualify that company. Otherwise, allow that company to renew and provide a negotiation in regards to rates and new benefits.
Mr. Campillo, if I may, thank you, Senator. If that modification were to be included in the revision of this bill, what would be the timeline that would you anticipate that would be fair to work instead of renewing on an annual basis? What would be the timeline of years?
So for instance, if I can give you a good example, which is the federal government, they issue what is called an annual call letter.
A what?
A annual call letter. So basically it's information that they ask the carriers as to what the new benefits are. They issue that at around March, of late February, March, and you're supposed to reply to that by May 31st. That's the renewal process, because you don't have to complete all of this documentation that currently the government of Guam requires you to do. So the process is rather simple. You shouldn't take more than a month to be able to do a renewal if you go into that route, because all you're doing is, these are your new benefits that you're asking for, and we have to validate the rates that we're providing to the government of Guam based on that. So,
Mr. Byrne.
Speaker and Senator, I don't disagree that the process could certainly be simplified. The issue is that we have to comply with overall GovGuam procurement law, and that's what actually drives much of this process, as well as the law that's specific to the health insurance. So if you had a proposal to kind of free the whole process from the general procurement conditions and simply concentrated on health insurance and no other procurement law would intervene, I'm sure the process could be made much simpler.
Thank you. Mr. Campillo, why does the bill call for the two most beneficial proposals? Why not the 3 or the 4, and why the 2?
We don't oppose more offers, so if you feel, Senator, that you need to make a technical challenge or a technical correction and do 3 or various, that will be okay with us. I don't think we have any objections to that.
So changing from 1 to 2 is quite significant. It changes cost and everything potentially, but changing from 2 to 3 or doesn't have that kind of impact you're saying?
Well, it's going to have an impact, but the government of Guam already had 3 carriers up until October 1 of 2018. And for some years, I remember in the 90s, you had 5 different carriers. Again, it dwindled down based on the fact that the healthcare economics changes. But 2, 3, we only have 4 companies doing health insurance in Guam. But to us, competition will not be something that we oppose. In fact, we encourage. And it would be beneficial possibly for the government of Guam employees and retirees.
Under this bill, Mr. Byrne, we're departing from the existing law that is very clearly intended to save some money in health insurance contract for the government of Guam. And the only thing I can see in here that may that you can use to try to save some money is that it asks for reasonable rates. And other than that, and then it does say which reflect the most economical and beneficial. I don't know, those 2 words together, do you think that's strong enough for you to get a, value for the government of Guam, or not even value, because we've always got value. What we want was to try to save like $50 million.
Yes, and it's unfortunate that we weren't able to test that because last year's procurement was effectively stopped and we were required to ask for a rollover. So it would have been really helpful if we were able to test that proposition, but we were frustrated in that. I guess it is very difficult to define in legislation, and I think I alluded to this in my testimony too, that very often these considerations are best left to a commercial negotiating process. It's not like that anybody on the negotiating team is not fully cognizant of both the benefits that are being proposed when we are able to open a proposal and the cost of those benefits. So I kind of sympathize with the drafter of legislation that tries to put this into legislation when it's really a commercial proposition.
I agree. It's either a bid and we say
But can
cheapest, or if we leave any kind of discretion, it's very hard to dictate that, yes.
But can also clarify something, Senator, that this is the only contract in the government of Guam that limits what an insurance company can keep. Because if the loss ratio is below 86%, we had to refund that money to the government of Guam. You don't have that on a contractor that is doing a road or building a building for the government of Guam or providing any other service. You don't have that. So you also have a safety guard that you don't have any place else.
Right, I see. Thank you. And about the negotiating team, I agree, but I think there are, the way the law is set up right now, several members of the negotiating team, or maybe quite a few, who represent just single agencies or that really are not responsible for the entire budget of the government of Guam, like you are, and like I feel like I am, and so that's the difference, right? That some of them, they want, of course, a package that looks great, and whereas we have to balance that with economy. But thank you both. Thank you.
Sidus Masi, Senator. If there are no other comments or questions, I just want to say thank you for being here this evening and presenting your testimony in reference to this bill 94-35 COR. And if there was anyone else in the listening audience who's watching at home would like to present additional testimony, written testimony, they can do so by sending it to speaker@guamlegislature.org or hand delivering it to 163 Chalan Santo, Papa, Hagatnya, Guam 96910. If there is no one else who wishes to speak or to share oral testimony, I'm going to call this bill number 94-35 COR publicly heard, and I will adjourn at 5:54 p.m. Sidus Masi, and have a good evening. Sana Masi.